Hello everyone and welcome to our channel MedStudy. Today in this video we are going to see about mechanism of normal labor. So mechanism of normal labor is the series of movements that occur on the head in the process of adaptation during the journey through the pelvis. Engaging anteroposterior diameter is suboccipitobregmatic, which is 9.5 centimeters, and engaging transverse diameter is biparietal diameter, which is also 9.5 centimeters. Now, cardinal movements of labor include engagement, descent, flexion, internal rotation, crowning, extension, restitution, external rotation, and expulsion of trunk by lateral flexion. This first image shows engagement, followed by descent, followed by flexion, followed by internal rotation, which is again followed by extension, followed by restitution, and lastly there is expulsion. So engagement is when the greatest transverse diameter of the presenting part, that is biparietal diameter, passes through the pelvic brim. In primigravida, it occurs around 38 to 42 weeks of gestation, and in multigravida, it occurs during labor or late first stage of labor. Most common cause of non-engagement at term is occipitoposterior position, deflexed head, and malpresentation. Descent occurs due to uterine contractions and relaxations or retractions, bearing down by the mother, and straightening of the fetal ovoid. Flexion is achieved by resistance offered by unfolding cervix, walls of pelvis, or by walls of pelvic floor. Internal rotation occurs due to slope of pelvis or shape of the pelvic floor. Crowning is the stage where maximum diameter of the head, that is biparietal diameter, stretches the vulval outlet and without recession of head even after the contraction is over. Extension, it is delivery of head takes place through the couple force effects. Successive parts to be born are vertex, brow, and face. Immediately after release of chin, head drops down. Restitution is visible passive movement of head due to untwisting of the neck. Movement of restitution occurs rotating the head through 1/8 of a circle in the direction opposite to internal rotation. External rotation is a movement of rotation of head visible externally due to internal rotation of shoulders. Lateral flexion, it leads to birth of shoulders and trunk after. So this concludes with the mechanism of labor. I hope you liked the video. Please do like, share and subscribe to our channel, and don't forget to press the bell icon. Thank you.